Hello everyone, I am Dr. Pradeep Gowda. I have recently completed my MD in Anatomy from Maulana Azad Medical College. So today I am starting my first YouTube session on the topic of tongue. So in this topic, we will divide into three parts. Firstly, we'll discuss the gross anatomy or the gross features of the tongue. Next, we'll discuss the development and the embryological basis of the nerve supply to the tongue. And next, we'll discuss the histology of the tongue. Firstly, we'll discuss the gross anatomy of the tongue. Tongue. It is a muscular organ. The main function of the tongue is taste, speech, mastication. That is what? Chewing of the food. Deglutition. That is swallowing of the food. Now, to discuss the external features of the tongue, I will make a sagittal section of head and neck region. So now firstly we are discussing the external features. So tongue as a apex or tip, it has a root, hand, body. So I will draw a sagittal section of the head and neck region. So if this is the nose, external outlining of the nose, upper lip, lower lip, mandibular region and neck region. And this is the cross section of the mandible and teeth, cross section of the hyoid bone. Mandible, hyoid bone. And above the, if this is whole, this area is the oral cavity. So above the oral cavity we have hard palate. Posteriorly there will be soft palate. And we know the from the mandible to the hyoid bone, the floor of the mouth is formed by the mylohyoid muscle. And in the posterior surface of this mentis symphysis, there are two tubercle or which are called as superior and inferior mental spine. From the inferior mental spine above the mylohyoid muscle, there will be one more group of muscle which is called as geniohyoid. Now we are going to make the outline of the tongue. So this is the outline of the tongue. Okay. In this, say seeing this diagram, we can say this part is what? Apex. This part, this area, this will form the root of the tongue. And the remaining whole area will be the body. So now we know apex, it is the tip of the tongue, and body and the root. So firstly we'll discuss the root of the tongue. Root of the tongue, it is formed by one major group of muscle, that is also, this is one muscle, that is fan shaped muscle. It has some fibers which are going posteriorly and some fibers going superiorly. This muscle is called as genioglossus. So this muscle is genioglossus. So the root of the tongue is formed by the lower fibers of genioglossus, which are running from the mandible to the hyoid region. So that will form the root of the tongue. Then the body, the remaining whole part is, this whole part is body. So it has a upper convex surface, that is called as dorsum, and anterior or inferior surface. So it has two surface, upper convex surface which is called as dorsum and inferior or ventral surface. So the body, it has upper surface which is convex, which is also called as dorsum, and lower or inferior or ventral surface. Okay, so this is the upper dorsum part and inferior ventral surface. So firstly, now we'll discuss the one more thing. Tongue, it forms the floor of oral cavity and anterior wall of oropharynx. So by seeing this diagram, we can say this is the tongue. It is forming the floor of the oral cavity, and behind the tongue, this area is oropharynx. So it is forming the anterior wall. So this transverse part will form the floor of the oral cavity, and this lower part of the tongue will form the anterior wall of the oropharynx. Now, firstly, we'll discuss the upper surface or the dorsum of the tongue. Dorsum of the tongue. To discuss the dorsum of the tongue, I am making another diagram seeing the tongue from superior surface. So the tongue is also divided into three parts. Like the dorsum, it is divided into three parts: oral part, pharyngeal part, and posterior most part. This oral part is the horizontal part of the tongue. So this is the oral part. The vertical part is the pharyngeal part, and the remaining this part is the posterior most of the part of the tongue. And this part is the epiglottis. The posterior most part is attaching to the epiglottis. So the oral part and the pharyngeal part is divided by a sulcus. This sulcus is called as sulcus terminalis. And the tip of the sulcus, where the two sulcus meet, there will be one foramen present. This foramen is called as foramen cecum. Okay. So in this way, the tongue is divided by sulcus into anteriorly present. This part is called as anterior two-third or the oral part, and the posterior one-third or the pharyngeal part. And the one significance of this foramen cecum, the foramen cecum is that part where the epithelium will invaginate to form a duct that is called as thyroglossal duct. So from this thyroglossal duct, the thyroid gland develop. If this duct persists, like if it doesn't regress during the embryological life, then it will lead to formation of thyroglossal cyst. So one clinical condition we have seen here. Now we have seen the anterior two-third part and the posterior one-third part. And we have seen the sulcus and the foramen cecum. And now posteriorly, as we know, posteriorly there was one more structure that is called as epiglottis. So the mucous membrane, the mucosal layer of the pharyngeal part will send some septation behind, folds behind towards the epiglottis. These are called as glossopharyngeal epiglottic fold. So the two lateral glossoepiglottic fold and one median. So this is the medial and two lateral glossoepiglottic fold. So this forms the posterior most part of the tongue. Between this fold, there is some place present. This place is called as vallecula. So now we have seen the anterior through two-third, posterior one-third, and the posterior most part of the tongue, and two folds, median glossoepiglottic fold, and this is median, and these are the lateral glossoepiglottic fold. Then from behind this sulcus terminalis, there are two another arches are present. So here one arch and here one more arch. So similarly we will make this side. Here one arch and here one arch. So this arch will name one is coming from the glosso palatine arch, and one more is glossopharyngeal arch. Okay, so by this arch, in between this arch, one fossa will be present here. This is called as tonsillar fossa. In this fossa, there will be aggregation of lymphocytes, and it will lead to a formation of one structure that is called as tonsil. So here there will be palatine tonsil present. And in the posterior one-third part, there will be aggregation of some lymphocytes in the posterior one-third part, and this is called as lingual tonsil. Now the anterior two-third part has some surface projections that is called as papilla. These are what? These are the surface projection of the inside lining lamina propria that is forming surface projection. So there are numerous papilla that are present in the anterior two-third part of the tongue. So this will help in increasing the surface area of the tongue. Now I will enumerate the different papillas. Firstly, the bigger one is the circumvallate papilla or the vallate papilla. Then fungiform papilla, then filiform papilla, and foliate papilla. These are rudimentary in human beings and it is most prominently seen in rabbits. The circumvallate and one more thing, these papillas contain taste buds. All these papillas contain taste bud except the filiform papilla. It doesn't contain taste buds. So if we will draw the papilla on the anterior two-third part. So firstly, in front of the sulcus terminalis, there will be circumvallate papilla. So, and along the lateral margin, this is the lateral margin of the tongue. So along the lateral margin, in front of the sulcus terminalis, there will be linearly placed foliate papillae. Then along the lateral margin till the apex of the tongue, there will be fungiform papillae. And on the tip of the, from the tip till the whole upper surface of the dorsum, it is covered by filiform papillae. So this is filiform papillae, this is fungiform papillae. These are circumvallate papillae, and this is foliate papillae. So in this way we have seen the upper or the dorsum of the tongue. Now we'll see what is remaining, this part, the inferior surface or the ventral surface of the tongue. So for that I am making the oral cavity, and this is lip, upper lip, lower lip. These are teeth, and this is the tongue, that is the inferior surface of the tongue. In the inferior surface of the tongue, along the midline, one frenulum is present. This frenulum is called as frenulum linguale. This is present from the root till the not till the apex, but beyond, like a little bit downward till the apex, because during the embryological time this apex, the frenulum linguale, will regress from the apex to the downwards, so that the tongue can protrude outward. If this frenulum is attached till the apex, then there is one more condition which is called as tongue tie or ankyloglossus. If the frenulum linguale is present till the apex, then it is called as tongue tie or ankyloglossus. Then lateral to this frenulum linguale, there will be deep dorsal vein, deep lingual vein. Lateral to this, there will be pad, one more fold will be present. This is called as plica fimbriata or fimbriated fold. And we know the frenulum linguale, it is a median fold that is actually the in the midline along the whole tongue. There will be one septum present, that is called as median fibrous septum. So along this septum only this frenulum linguale will be go, but it will not present till the apex of the tongue. So now we know this was the inferior surface of the tongue, and we have seen this part, this is whole the inferior surface, right? And in the midline we have seen this is frenulum linguale, deep dorsal vein, and plica fimbriata. Now we'll see the muscles of the tongue. What are the different muscles that are present in the tongue? Firstly, the muscles, these are paired. These are divided by the tongue is divided by a median fibrous septum. In this way, the tongue, it has paired group of muscles, and in that also it is divided into two parts: extrinsic group of muscles and intrinsic group of muscles. Extrinsic group of muscles and intrinsic. Now the function, I will discuss firstly the function and how it origin and get inserted. So the intrinsic means the muscle originate inside the tongue and inserted in the muscles of the tongue. Extrinsic means it originates from outside of the tongue and comes and become the content inside the tongue. And the function, intrinsic muscle mainly alter the shape of the tongue. Extrinsic is mainly for the movement of the tongue, and it also helps in alteration of the shape, but main function is movement. Intrinsic's main function is alter the shape of the tongue. Now, the intrinsic muscles are superior longitudinal muscle, inferior longitudinal muscle, vertical muscle and transverse muscle. The extrinsic muscles are some muscle is coming from the mandible and forming the part of the tongue, that is genioglossus. Then from the hyoid bone, the muscle is originating and coming towards the tongue, that is hyoglossus. Then from the styloid process of the temporal bone, the muscle is originating and coming and forming the part of the tongue, that is styloglossus. Then from the upper part of the soft palate, palatoglossus. So these are the extrinsic and intrinsic muscles. For that we'll draw now a diagram to show the extrinsic and intrinsic muscle. So we are taking a coronal section of the tongue. Okay, so it means we are cutting the tongue like here and we are seeing like this. So I am taking one coronal section of the tongue. So you can see this is the apex, dorsum, inferior surface, and I've taken a section over the coronal section. So in midline I have told ki one septum will be present, that is called as median fibrous septum. Now I am going to draw the muscles. So firstly the intrinsic muscle, this is superior longitudinal muscle, inferior longitudinal muscle, transversely placed transverse muscle, and vertical muscle. So what is this? Superior longitudinal muscle, inferior longitudinal muscle, transverse muscle, and vertical muscle. So these are all intrinsic muscles. Now I will place, so seeing this you can say, so superior longitudinal was going from the apex till posteriorly, so this is superior longitudinal, this is inferior longitudinal, and from the median septum some muscle is going towards the lateral margin, this is vertical transverse muscle, and some muscle was passing from above from to the root, so this is vertical muscles. Now, in between the medium septum and the inferior longitudinal, there will be genioglossus muscle. And lateral to this inferior longitudinal, there will be hyoglossus muscle. And lateral to this hyoglossus, there will be styloglossus muscle. And towards the transverse and vertical muscle, there somewhere there will be palatoglossus group of muscle. Okay, so now this is genioglossus, this is hyoglossus, this is styloglossus, and this is palatoglossus. So these all are extrinsic muscles of the tongue. Okay, so we have seen genioglossus, hyoglossus, styloglossus, and palatoglossus. Seeing this is the what inferior longitudinal muscle. It is lying between genioglossus and hyoglossus. Okay, so now we'll to understand the extrinsic muscle, we'll draw one more diagram of the parasagittal section of head and neck region. So I'm making a parasagittal section of head and neck region. So now we know this is mandible, so we'll make a teeth here. and this is hyoid bone, and here we'll make two tubercle behind the mental symphysis, superior mental spine and inferior mental spine. And we know the base of the mouth is formed by floor of the mouth is formed by mylohyoid. Above that we know one more muscle, geniohyoid. Now we'll make the tongue. So now we know this is the upper surface or the dorsum of the tongue in that oral part, pharyngeal part and posterior most part. This is the inferior surface of the tongue. Now I'm going to add that fan shaped muscle that is originating from the superior mental spine. Some fibers are going posteriorly towards the hyoid, so forming the root of the tongue, and some fibers are curving towards superiorly. So there are two types of fibers. Some fibers are going posteriorly running fiber and some are running superiorly. So this main muscle is called as Genioglossus. Then from the hyoid bone, from the body of the hyoid bone and the greater horn of the hyoid bone, so one more muscle we have seen. So I'm changing the color to show this is the hyoid muscle, hyoglossus muscle, that is coming and attaching to the genioglossus. So this is hyoglossus muscle. Hyoglossus. Then styloid process, that is part of the temporal bone. From the anterolateral surface of the styloid process, one more muscle will come and attach to the genioglossus and hyoglossus. This is styloglossus muscle. So this is what? Styloglossus. And we know from above here that the hard palate was there, and posterior to it the soft palate was there. So from the palatine process of the soft palate, one muscle will come and attach to the tongue, that is palatoglossus. So this is what? Palatoglossus. So in this way we have completed the extrinsic muscle: genioglossus, hyoglossus, styloglossus and palatoglossus. So now we'll see the action of these muscles. So seeing this diagram, firstly we'll discuss the action of the intrinsic muscles, superior longitudinal muscle. So this is the superior longitudinal muscle. When this muscle will contract, when this muscle will contract, superior longitudinal, it will do the shortening of the tongue, plus it will make, see the tongue, it is convex on the dorsum surface, it will make it concave and it makes the tip curl. So curling of apex plus concavity on the dorsum. So superior longitudinal muscle, shortening, curling of apex and concavity. Similarly, this is where the inferior longitudinal is there. Inferior longitudinal will also shorten the tongue, but it will uncurl the tongue apex and makes the surface convex. So inferior longitudinal, shortening of the tongue plus uncurling of apex plus convexity of the dorsum. Then by seeing this, these are the transverse group of muscle. When this transverse muscle contract, it will lead to narrowing of the tongue, narrowing and elongation of the tongue. So transverse muscle will, what it will do? Transverse group of muscle, narrow down the tongue plus elongation of the tongue. Then vertical muscle. When this vertical muscle will contract, it will lead to flattening of the tongue. Flattening of the tongue. Then, so now we have seen the action of the intrinsic muscles of the tongue. Now we'll see the extrinsic muscles. What action the extrinsic muscle do? So genioglossus, it will mainly, see, the genioglossus is attached like this. So it will mainly protrude the tongue and depress the central part of the dorsum. So protrusion of the tongue plus depress or depression of the tongue at central part of dorsum. Then hyoglossus. By seeing this hyoglossus, you can say it will what? It will depress the tongue. Then styloglossus. Styloglossus will retract the tongue back. So styloglossus will retract the tongue back. So it is an antagonist to the genioglossus. Styloglossus, retraction. Then palatoglossus. Palatoglossus is what? It is elevating the tongue in the posterior parts in such a way that it is closing the oropharyngeal isthmus. So you can say this part is oral part, here the pharyngeal part. So the closing of this oropharyngeal isthmus is done by the palatoglossus. Closing of oropharyngeal isthmus. How? By elevating the posterior part of the posterior 1/3 part of the tongue. So now we have seen the muscles and their actions, their origin and insertion. Lastly, we'll see the blood supply. So mainly blood supply, the arterial supply is by lingual artery, that is a branch of external carotid artery, and venous drainage is by deep lingual vein and dorsal lingual vein. Deep lingual vein and dorsal lingual vein, and it will go and drain into internal jugular vein.